we agree that we don't have that situation, then something needs to be done. Unfortunately, we are bombarded with a lot of information, and a lot of information is wrong, sometimes outright lies. And there are several things that is wrong, I would say is wrong with the NHS. First is the lack of understanding of who we are as human beings. We are not just physical human beings. We possess mental bodies, but essentially, and we as Christians understand this, that we are spiritual beings. We are spiritual beings being housed in a physical body. So, to put another analogy, someone stays in a house called number 10 Downing Street. Probably his name is David Cameron. Now, I wouldn't identify David Cameron with his house, with 10 Downing Street. That would be absurd. So, we as Christians, we shouldn't identify ourselves with our spiritual being. We should identify ourselves with our spiritual beings. It is our spiritual beings, it is our true self. And when you imbibe the essence of your true self, who you really are, spiritually, then it makes it easier to overcome all these diseases, illnesses, and infirmities that we face. Some of you may not understand it, but I'll put it to you that there is a lot of the things that goes through in terms of the healthcare that we're receiving is motivated by power and money. A lot of it. Many times, the things that they tend to ignore about food, about other therapies that we could use, is being ignored specifically to promote the things that brings money and power to a few people. And all this, and some of the treatments we actually see, goes against our spiritual values. And there is no real essence of trying to find the real reason, the root causes of the disease. Other problems with the NHS. I'll also say that there's a difference between smoke and fire. If you go to a doctor, your GP, with certain infirmities that you're facing, and he identifies the symptoms and addresses the symptoms, that doesn't go far enough, because he's addressing the symptoms, or he or she is addressing the symptoms without going to the root cause of the disease. And without identifying the root cause of the disease, your problems will not go away. So, for example, how many of you would see a house on fire and start waving at the smoke coming from the house? You're just attempting to address the symptom and not the disease. You'll go to where the fire is and attempt to quench the fire. That is where the problem actually is. And I'll say that most of the problems that we have when it comes to chronic disease comes through our lifestyle, our thoughts, our minds. And that actually part of what it is in our spirits as well. And I've mentioned here that it's a situation of a square peg in a round hole. When you use drugs as the sole remedy when it comes to chronic disease, it's a square peg in a round hole. It just would not fit. Our bodies are not lacking chemicals. Our bodies are not lacking drugs. We don't need these chemicals in our bodies. We do not need these drugs in our bodies. So no matter how much you are being prescribed with these drugs, and no matter how long you use them, it would not work. And so there's an essence in which drugs is being promoted above everything else. And then there is an issue of named disease. This is what I call part of the misinformation and being misled, is that names are given to different diseases. And the names being given to different diseases it puts a distance between the health provider and the patient. And I have some examples here. Although I know some of you have an understanding of what these diseases are all about, but just by looking at the name, what does it tell you? Take diabetes for instance. Just hearing the name, what does it tell you?
Diabolic.
Huh? You can pick anything there. You can choose. What does it tell you?
We're able to identify what's wrong with the person.
Pardon?
I said we're able to identify what's wrong with the person.
Okay. Okay, so let's take diabetes for instance. When you hear the word diabetes, what does it?
Sugar levels.
Sugar level.
Yeah.
Okay. Osteoporosis, anyone? Bones. Bone density. Alzheimer's.
Mind.
High cholesterol.
Diet. Fat.
Heart. Blood.
Yes, diet.
We've got cancer on the list.
Nobody knows.
Depression.
Mental.
Infertility. These are just examples, by the way, but you get the idea. What I'm trying to say is that by naming diseases the way it is being named, with technical names, it puts a distance between the healthcare provider and the patient, because some of these names frightens them. You say, I thought I listed some other complex ones, but there are some complex names that, patients will hear and they just, oh no, what is this? Just begin to fall apart. Names is very, very powerful. And if you call things like HIV, AIDS, people say, oh, what is this? It's all over. It's not all over. It's because names can be very powerful. And if you don't call things as it should be, it causes fear. It causes people to panic unnecessarily. Now I've decided just to put with this list my own definitions, and you can come up with your own. Diabetes, you can say it's cell insulin resistance syndrome, meaning that your cells are not able to receive the glucose it should receive. That is basically what diabetes is. Or cancer, sluggish immune system syndrome. Your immune system is not powerful enough to deal with the cancer cells. That is all it is. And we could talk about brittle bone disease for osteoporosis, or Alzheimer's, you can say feeble mind. So when you see diabetes, and if I was to say, okay, your cells are insulin resistant, what would be your next question?
How can I?
Sorry, madam.
My next question would be, how can I walk
And if I was to say, high cholesterol, and I said fatty food choice disease, what would you then say beyond that? Because some of the fatty foods. So, how about depression? And if I was to say to you, as a healthcare provider, that, oh, depression is as a result of, amongst other things, sunlight deficiency disorder, what would you then say back to me?
Go on holiday.
So, Henry, what would be your response? Go on holiday to somewhere sunny. Or how about someone who has difficulty getting conceiving, and I said to them, oh, it's hormonal imbalance syndrome. What would then be the reply?
What can I take to balance it?
Here is what I'm trying to put to you this morning, is that all diseases, no matter what ever name is given, can have a simple, straightforward solution.